Singapore is set to see an exponential rise in COVID-19 infections, and the next few weeks will be critical.
Very soon we will reach 1,000 new cases a day, and in a few weeks' time we will probably get to 2,000 new cases a day.
Invitations for vaccine booster shots will be sent out from next week to seniors 60 and above and residents of aged care facilities. And what's a good name for a boy panda? You can submit your ideas to Wildlife Reserves Singapore. Good evening. You're watching The Big Story live in the Straits Times newsroom. I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode. The next few weeks are going to be critical in Singapore's battle against COVID-19. Well, that's the message from ministers at a multi-ministry task force press conference this afternoon. And here's why. The number of daily cases has been rising over the past fortnight, from an average of 76 cases per day a fortnight ago to 288 cases per day in the past week. At the current trajectory, it's likely that we will soon reach more than 1,000 daily cases.
Our cases started rising sharply 18 days ago on the 23rd of August when we hit almost 100 cases, 94 to be exact. And from then, 24th August onwards, it's been rising at a very steep curve. As far as possible, we don't want to reverse course in our transition plan. We need to monitor the incidences of severe illnesses and deaths closely in the coming 2, 3, 4 weeks.
We also do not think it would be prudent to press ahead with any opening measures during this period, especially when we are in the midst of an exponential rise in infection cases. In fact, that would be a reckless thing to do under current circumstances.
Professor Teo Yik Ying is here to weigh in. He's the Dean of NUS's Swee Hock School of Public Health. Welcome back to the show, Professor. Today's COVID-19 Task Force press conference was the third in a week. Professor, what are your quick reactions to it?
Thank you very much for having me. So indeed, I think this has been a busy week for many of us, and rightfully so, given that we saw consecutive days where community infections were very high. In fact, the highest ever since the start of the COVID-19 pandemic about 20 months ago. And I think there is a need to address this directly, especially with respect to Singapore's plan to live with COVID-19 eventually. I think people will be wondering whether we should be worried with 400, 500 cases that are being reported daily, or whether this is exactly what we expect to see as Singapore gradually reopens. And I think the key to managing a public health crisis is always frank and consistent communications, so people understand what the strategy is and whether what is happening on the ground right now reflects what we expect to see as part of the game plan. So today's press conference, in my opinion, is a strong reminder that we are staying true to the game plan to eventually treat COVID-19 as an endemic disease. And I think Minister Gan said very clearly today that as Singapore reopens and more people start to move about in the community and going to work, the increase in COVID-19 cases will be expected. It's entirely to be expected. And of course, we would have hoped the numbers wouldn't increase so quickly. But given that what we've learned today, out of all those that were fully vaccinated and who subsequently became infected, 99.2% of them were asymptomatic or mildly symptomatic. And what that really means is that the vast majority of the fully vaccinated people who became infected never really progressed on to need intensive hospital attention. And this is exactly the signal to say we can confidently move along with the COVID-19 strategy. So I found today's announcement reassuring and consistent with the game plan for Singapore to become COVID-19 resilient.
Professor, let's talk about the rise in cases in just a bit. I just want to focus on something else first. The push for more frequent testing, especially self-testing. Now, households have their own ART kits now. Workplaces have testing regimes and so on. What do you make of the strategy to boost testing?
So we are certainly relying more on testing now, especially with the use of antigen rapid test kits. And these are the test kits that you can buy from pharmacies, from supermarkets, and what the government is distributing to every household. And actually, from a public health perspective, getting people to self-test, if they know they will be going to crowded public spaces where there may be a number of vulnerable seniors, or if they're attending large events, or maybe even before they visit a vulnerable senior, like their grandparents or great-grandparents, such self-testing is actually going to be increasingly important. And if testing more actually means that we are able to allow more activities to resume, then this is actually the kind of measures that we need to balance public health and the economy. And testing more should never just be simply to scare ourselves with larger numbers of infected cases, especially when most of these people we know, if they are infected because they are fully vaccinated, are going to be asymptomatic and they may not even know they are infected otherwise. And by doing so, I think we will actually reach that peace of mind that we are unlikely to be infecting the people that we care about as we move about with our daily activities. And I think moving forward, this personal and social responsibility will become increasingly important. That if you're in doubt, you self-test. If you don't feel well, or even just feeling a little bit sniffly, you self-isolate. And if symptoms persist, you see a doctor. All of this will really make the difference to reduce the amount of transmission happening in the community.
Professor, exponential. Now that's how the ministers described the recent rise in local cases after August 23rd, which saw 94 infections in the community. Now fast forward to yesterday when 450 local cases were reported. Now let's have a listen to what Minister Wong said.
All countries that open up have had to deal with such waves. For us, it is happening faster than we had expected. And it's also the first time since our opening that we are facing such a new exponential wave of infection in our community. Very soon we will reach 1,000 new cases a day. And in a few weeks' time, we will probably get to 2,000 new cases a day.
Professor, while the rise was predicted, the rate of it was faster than the task force expected. What factors could have led to this speed?
Well, the first and main reason is really the Delta variant. Because if you compare what we were allowed to do socially for dining right now with what we were doing in January to April this year when we were in phase 3, where we could dine out for 8 people, lots of activities in public spaces, including barbecues and camping in pubs. We are actually much more restricted now than back then. And yet, back then, we never saw such sharp spikes in case numbers. And I think that's because we know our safe management measures worked. And the strain of coronavirus spreading about in Singapore back then was not as transmissible as the Delta variant. So right now, almost all the cases that we see daily are caused by the Delta variant, and the way it spreads is much faster and of a bigger scale. And of course, the second reason is, again, quite straightforward, that we have relaxed measures so much more that people are moving about in the community, dining out in public spaces, returning to work. And actually, with most infectious diseases of this nature, with more people moving about and interacting, clearly much more chances for the coronavirus to spread. So really, Delta plus the fact that we are reopening is a perfect mix for the COVID-19 to spread fast in the country. And I should emphasize, this isn't just happening in Singapore. It's actually happening as fast or even faster in many other countries.
It is yesterday, 664 COVID-19 patients are warded in hospitals. Professor, we know we've spoken about this while the focus should be on serious cases and those in ICU. But at this stage, Professor, at 664, shouldn't we also pay attention to all hospitalized numbers? After all, this would still strain the healthcare system.
Actually, yes, you are right. We should pay attention to the number of COVID patients in the hospitals. But provided they are there because they actually require the care and attention provided by a hospital. So Singapore all along has taken a very cautious approach towards putting many of the infected people in hospitals, including many who are actually asymptomatic or only mildly symptomatic. And I think this is why today's announcement, where they also talk about allowing the home recovery pilot now to be extended, because the findings have shown many of these people who are asymptomatic, mildly symptomatic, are able to self-isolate and recover at home, and they do not actually experience any negative outcomes along their recovery process. So moving forward, more and more people will be allowed to recover at home, even when they are infected with COVID-19. And I think this will then allow the hospitals to really focus on the symptomatic patients with COVID, and these are the ones who may have a real need for the kind of the care and attention provided by hospitals. And Singapore actually put a lot of people in hospitals, like what we say, out of an abundance of caution. And I should highlight that actually many countries, including countries such as the United Kingdom, Japan, with comparable advanced healthcare system as Singapore has, actually they have been doing exactly that, putting their asymptomatic and mildly symptomatic cases to self-isolate and recover at home. So I think moving forward to a COVID-19 resilient Singapore, I expect more and more people will just self-isolate at home when they test positive. And I must emphasize, this is not compromising on the health and well-being of the people, but this is exactly the right sensible move, that we ring-fence and prioritize the healthcare resources on those that will truly need it.
Thank you so much for your time and your perspectives, Professor. I've been speaking with Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Now, like what Prof. Teo just mentioned, the home recovery scheme to allow fully vaccinated COVID-19 patients with mild or no symptoms to recover at home will be gradually expanded to include patients up to 50 years old. This follows a successful pilot, and from September 15th, it will now be the default care management protocol for vaccinated patients.
We will move decisively on home recovery. This is very important so that hospital beds are allocated to those who truly need medical attention. And it's important, very important to do this when case numbers rise. Today, the large majority of infected patients are in hospital more for observation, and most are discharged uneventfully.
The Health Ministry also said today that parents are encouraged to have their infected children recover at home, as long as they are at least 5 years old and don't have underlying illnesses. These kids will need to be assessed first by the hospital to be clinically fit for home recovery. And from next week, the quarantine period for those at risk of exposure will be shortened from 14 days to 10 days from the date of last exposure. This provided the affected person tests negative at the end of quarantine, and he will need to continue to conduct daily antigen rapid tests from after the shortened quarantine period to day 14. This change is to account for the Delta variant's shorter incubation period, which is an average of under 4 days, compared with an average of 6 days for the original strain.
Compared to last year, with the wild-type variants that we encountered then, we've seen more people presenting this year with shorter incubation periods, with a mean of 4 days or less, compared to a mean of 6 to 8 days previously. And this means it takes a shorter time for people to develop the infection and to be infectious, even before they become symptomatic. The shorter incubation period leads to a greater risk of amplification and dispersion of infection if infected people continue with their social and work activities, particularly if it's working away from home. It is therefore not surprising to see large clusters of cases then detected at the onset when we pick up an initial case of COVID-19 in the community. The larger dispersion makes it more challenging to manage and control clusters.
And there's a start date for Singapore's vaccine booster program from next Tuesday, September 14th. Seniors 60 and older, as well as eligible residents of aged care facilities, will be invited to register. Those who have completed their 2-dose regimen at least 6 months ago will receive SMSs sent to their mobile numbers that they have had registered with earlier. They can then book a new appointment on vaccine.gov.sg. People moderately to severely immunocompromised are also included in this initial batch. In other local headlines, nearly a month after the birth of Singapore's first panda cub, the River Safari held a gender reveal party today as part of its father Kai Kai's 14th birthday celebration. Kai Kai releasing a shower of blue confetti, announcing to the world that his firstborn's a boy. Meantime, the little one is being cared for by its mother Jia and growing day by day. And in keeping with tradition, he'll be given a name before he turns 100 days old on November 21st. Details on how you can take part in naming the cub can be found on Wildlife Reserves Singapore's website, and a short list of names will be released for public voting. Shareholders of Singapore Press Holdings have voted in favour to hive off its media business, paving the way for the formation of a new company limited by guarantee. At a virtual EGM held today, 97.55% voted in favour of the plan. The new CLG will initially receive financial help from SPH, comprising $80 million in cash and $30 million in shares. SPH publishes the Straits Times. Meanwhile, after initially rejecting a town hall-style meeting, National University of Singapore President Tan Eng Chai has agreed to an online town hall with parents of Yale and US college students to hear their questions about the school's closure. The meeting will also be open to parents of students in the university scholars program. The exact date for the town hall hasn't been set. According to mobile operator and internet service provider MyRepublic, the personal data of nearly 80,000 mobile subscribers here was potentially hacked. Affected data may have included scanned copies of NRICs, employment data, as well as copies of utility bills that state residential addresses. MyRepublic said there's currently no indication that other personal data, like account or payment information, was hacked. Systems were also not compromised. In light of changes to the Primary 1 registration framework, parents were busy on chat groups and forums discussing how to get around the new rules that will kick in next year. Among their top concerns, if the tweaks would indeed result in less competition and stress during the annual exercise. Briefly, the changes include the doubling of places set aside under Phase 2C to 40 and the combining of Phases 2A1 and 2A2 into a single phase. Now, netizens have commented as well to the Straits Times' Facebook posts on these developments. Some welcomed the move, like JJ Lau Chin Chair, who wrote, "More sensible for kids living near the schools to have more chances of entering, cuts down on time spent on travelling." Henry Sharp had a similar sentiment, saying the change is a step in the right direction. But he also noted the perennial differing opinions that Singaporeans will have on which comes first, proximity or school affiliation. And as a further change to Phase 2A meant for children of alumni, Ricky Budell suggested, quote, remove the volunteer and the joint management of advisory committee. The Straits Times' senior education correspondent Sandra Davie has written a story on it, and she's here to share more. Welcome back to the show, Sandra. You wrote in your piece that alumni will be the group of parents most affected, especially vis-a-vis the Phase 2 changes. In what ways, Sandra?
Alumni who are affected say, where are these additional 20 places coming from? So invariably, it has to come from the earlier phases. In Phase 2A1 and 2A2, which is mainly for alumni. Straits Times also did an analysis of the data for P1 registration this year. We looked at it carefully, and there are about 19 schools that only had about 41 places left for Phase 2B and 2C. Yeah? So assuming that the demand in the earlier phase 1, is for siblings, those of them who have siblings studying in the same school, you can assume that alumni of these schools who come under the next phase, right, are likely to face more competition, which is why, and these 19 schools include the usual very popular schools, Catholic High, Itong, IJ St. Nicholas, Southview, St. Hilda's, and Rosyth. So all very popular schools with parents. So I think, and a strong alumni group. So obviously, the alumni are going to be affected by these changes. Yeah.
So, Sandra, who stands to gain the most from these changes?
Okay, so basically, the parents who will gain, or the children will gain, are those who have no connections to the school and come under phase 2C, and are happy to actually put their kids in a school near their home, right? So that they don't have to travel too far to get to school. Maybe you don't even have to take the school bus or wake up too early. So they will be the ones who will gain from this change, because under phase 2C, those who live within 1 kilometer to the school will get first priority, and then it'll be followed by those who live within 2 kilometers to the school. So they will be the ones but they have to be happy to send their kid to a school near their home, whether or not it's a popular school. Yeah.
Sandra, even though, this group of people stand to gain the most, you mentioned in your story as well that it won't lessen the competition. And let's talk about the 20 extra spots as well. I mean, it's 20 extra spots. How significant is that?
Well, it's 20 extra places, all right, even at the most popular schools. And it just improves the chances for those who have no other connections, right? But on the other hand, I say that, I wonder whether it will lessen the stress and competition for places, because yesterday, after the MOE's announcements came out, immediately I went to the parents' forums and chat groups, and already parents were discussing, how can we game this, the system now, right, from next year? And a lot of them were already talking about, okay, so it looks like I have to move to be closer to the school, because at every phase, the let's say more alumni than places apply under phase 2A, right? So what happens is then they will give priority to alumni who live near the school, right? So as one parent said, on top of being an alumni, now I have to live near the school. So how is this going to, lessen the competition and stress? So yeah, I mean, basically parents have to stop this behavior of hankering after just the popular schools, which they think are the schools that are going to help their kids do well in the PSLE. But really, as ministry keeps saying, our schools are all very well resourced. They're very well trained teachers. And a lot of schools, other than the popular schools, offer a lot of programs which are quite interesting. And really, they should be looking at some of the information provided on these schools and think in terms of, which school best suits my child, not which is the top school I can get my kid into. Yeah.
Well said, Sandra. Thank you so much for sharing your insights. That was Sandra Davie, Senior Education Correspondent for The Straits Times. A link to her story is in the description below if you're watching us on YouTube. A fantastic sporting achievement before I go. Emma Raducanu, Leila Fernandez, two teenagers in the US Open Women's Final. The last time that happened at a Grand Slam, 22 years ago in 1999. British 18-year-old Raducanu, whose mom is Chinese, hasn't dropped a set all tournament and even had to play 3 qualifying rounds to get to the main draw, which makes her the first qualifier ever to reach a Slam final. Meanwhile, Fernandez turned 19 this week. The half Ecuadorian, half Filipino player beat 3 top 5 women en route to the final, including defending champion Naomi Osaka. What a final this will be. It's on Sunday, September 12th. May have to set your alarms for this one, guys. Wow, 18 and 19 and in a Grand Slam final. Amazing. Now, I remember when I was a teenager a mere 5 years ago. Well, for more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below. I'm Haryanto Diman. Thanks for watching The Big Story. Have a good weekend and we'll see you next week.